Okay, I got cut off there, so I'm going to pick back up where we were here a minute ago. Okay, so here you see again how um, this connects up to the uh, atypical antipsychotics specifically relate to some of these specific types of dopamine and serotonin neurotransmitters. Um, so, um, will, like I said, it's part of so basically what you're doing is uh, you're blocking dopamine receptors specifically for these types of dopamine and also serotonin receptors. And what ends up happening is you lessen the amount of dopamine and serotonin in the cells. And so, but what you're doing then because of that is you are impacting not only the amount of serotonin and dopamine in the cells as they relate to psychiatric disorders, you also are impacting the level of dopamine and serotonin specifically and how they impact with these specific types of receptors, um, which affects the person medically. And so it tends to impact the psychiatric symptoms, but while at the same time also impacting on some medical issues as well. Onset of so usually takes 1 to 2 weeks for the full effect as far as preventing psychotic episodes from occurring. So just move on. A couple of things on. Dialysis. This is the one thing. No, this is where we get connected with the Zyprexa and diabetes, and this is also true of clozapine, but it's particularly true of Zyprexa. Notice here, olanzapine, Zyprexa, is not removed by dialysis. So whatever negative impact the medication is having on the person's medical issues, if they have diabetes, those problems are not removed by dialysis. So even though this may be a good thing for treating the psychiatric illness, so if a person's on Zyprexa and they get dialysis, it's not going to remove the medical effects, the positive medical effects of the dialysis, but it still is in the system. It can continue to impact on the person's physical function. So the physiological effects of Zyprexa are still there. So some other things about it. Notice here, Zyprexa has been found effective in autism, also in producing weight gain in patients with it. So weight gain can actually be a good side effect if you have someone with anorexia. But if you have someone who doesn't have a weight problem, producing weight gain is can be a problematic side effect. Okay. Okay. So I wanted to talk about some of the adverse effects, because here we go. Weight gain, one of the adverse side effects, higher cholesterol, which is why you see higher cardiovascular disease in individuals who are using Zyprexa, increased risk of heart attacks and strokes in dementia patients. Insulin-resistant diabetes, more impaired in Zyprexa compared to other psychotics. So Zyprexa is associated with increase in insulin resistance in both obese and non-obese patients. So there's a real strong problem. There's a real strong impact of Zyprexa on a person developing diabetes. So regular assessment of blood sugar is strongly recommended when someone is on Zyprexa. So again, where I was going with this was I just wanted to talk a little bit more about Zyprexa and the effect of Zyprexa. Zyprexa and clozapine are two of the antipsychotics that have the most medical side effects associated with them, and really two of the psychiatric medications that have the most medical side effects associated with them of any of the psychiatric medications. So diabetes is now the other problem that can be associated, as we talked about, there's two general categories: the medical side effects that's associated with diabetes, and particularly antipsychotics, but also the impact of the psychiatric symptoms on the person's behavior. So individuals who have diabetes and severe mental illness also tend to be inconsistent with doing the medical things that they need to do, checking blood sugars, watching their diet, exercising. All those types of behaviors tend to be impacted more often by diabetes. Another, this can be particularly an issue with children and teenagers. If you've got children and teenagers who have some form of oppositional defiant disorder, which is a behavioral disorder, but not really severe mental illness, but still a behavioral disorder, you can have some of those problems as well. They will not follow through on the rather strict diet, exercise, lifestyle changes that someone has to make when they have diabetes. I also want to talk that this is another factor that's associated with higher medical problems for people with severe mental illness. But I wanted to talk about the issue of healthcare access, which tends to be much lower for individuals who have severe mental illness. And even if the access is out there, they may not know or be cognitively or emotionally capable of making use of whatever resources might be out there for them. So some things that have been found with severe mental illness is there is a much lower rate of screening for diabetes. Many people, generally people with severe mental illness, have a much lower rate of being screened for diabetes and for other medical illnesses. This also is why psychotropic medications themselves do not have a high level of problems that they cause for pregnancy. Some psychotropic medications are associated with problems in pregnancy, but there's usually an alternative. So that there are a number of psychotropic medications that have found to be generally safe for pregnant women. You may have seen on the slide there that Zyprexa was specifically listed as not showing problems for pregnant women. But a lot of individuals with severe mental illness do not follow through on a lot of the tests and checkups and dietary and lifestyle changes that are often important when someone is pregnant. So you often have individuals who have severe mental illness who will not follow, who end up having problems with pregnancy, not because of the medication, but simply because their mental illness contributes to them not being consistent with the things they need to do in order to effectively take care of themselves and their baby when they are pregnant. Cardiovascular disease is another problem that tends to be at a much higher rate for individuals with severe mental illness. Some of the lifestyle problems that can be associated with cardiovascular disease are also higher in severe mental illness. They include smoking, obesity, hypertension, cholesterol, and diabetes, as we talked about. All of those are correlated with cardiovascular disease. Individuals with severe mental illness tend to be in the lower socioeconomic group, and that tends to be a higher, being in a lower socioeconomic group tends to occur at a higher rate in individuals who have severe mental illness. Cardiovascular disease, heart attack, stroke, and that sort is the most common cause of death in individuals who have severe mental illness. Cardiovascular disease is 2 to 3 times higher in individuals with schizophrenia and bipolar disorder than is the case for the general population. Individuals with severe mental illness are more likely to be overweight and also tend to be smokers. Antipsychotic medications tend to have a high, tend to be associated much more often than other medications with sudden cardiac deaths. So there is a higher rate of sudden cardiac deaths for individuals with who are using antipsychotics, both the typical and the atypical, than there is in the general population. And that last one is not fully understood. There is a higher rate of cardiovascular problems, severe cardiovascular problems associated with the use of antipsychotics. Exactly why is not well understood. It's there, but why it's there isn't fully understood. Viral diseases tend to occur at a higher rate for individuals with severe mental illness. This could be again in the category of medical side effects. It could be that psychotropic medications tend to leave the person more susceptible to viral diseases. Also, in terms of lifestyle approaches, drug use is much higher in individuals with severe mental illness, and drug use can lead to things like hepatitis C, which is a viral disease. In terms of COVID tends to be more highly associated with severe mental illness because, again, individuals with severe mental illness are less consistent in doing things like following safety protocols, following social distancing rules, wearing a mask, all those sorts of things. There is not any sort of evidence out yet that the psychotropic medications tend to make a person physically more susceptible to COVID. There has been some research to suggest that antipsychotic use, and generally psychotropic medication can lower a person's immune system, weaken it, but that's not very consistent as far as that research goes. Respiratory illnesses tend to be much higher in medications used for severe mental illness, particularly antipsychotics. So you have things like at a higher rate of COPD. Smoking, it's important also to keep in mind that a lot of people with severe mental illness smoke, and tobacco use, of course, can be associated as well with psychotropic. Smoking is highly associated with respiratory illness. There are sexual side effects. So sexual dysfunctions are often common. Those are directly related to the side effects of medication. We had talked earlier about the sexual side effects associated with Zoloft. And then osteoporosis also tends to be at a higher rate in individuals who are taking antipsychotics. Okay, so I just wanted to go through that. Now, there's other videos I know for you to watch this week, And we will pick this up when we meet for our next class.